like to talk about boundaries and the difference between boundaries and walls, and how the power of medical jargon keeps nurses themselves away from feeling what they're really doing and what's going on with their patients. Therefore, it gives them a certain amount of, it's more of a wall than a boundary, because it gives them a certain amount of distance from the human condition, from the patients that they're taking care of. I was reading something the other day that was written from within the medical system to the healthcare system. And it was called Preventing Wrong Site Surgery Requires Hospital and Physician Support. And I read the first line, and it said wrong site surgery occurs 40 times a week in the U.S. And my brain did a funny thing. I thought, wrong site, does that mean they operated in the wrong room? Possibly in the bathroom instead of the operating room? And as I read, and it explained that 40 cases every week are wrong site, it occurred to me that they're talking about patients and parts and amputations of legs, kidneys, wrong patient, wrong site. They're talking about everything that has to do with real human beings. But they called it Preventing Wrong Site Surgery. Now, we've learned not to say the case, the gallbladder in 21, or the case in 322, but somehow within healthcare, to protect ourselves, we say things like preventing wrong site surgery. Oh, and the big thing in this, from healthcare worker to other healthcare workers, is that nobody said anything about the pain of the patients. I went back and I looked at a piece written about the same situation to regular people, to patients, to the consumer, in the Washington Post. And it started with the pain of wrong site surgery. It talked about amputating legs and kidneys. It talked in human terms. So what have we got to learn from this? We've got to learn that by setting up boundaries that are really walls, in order to protect ourselves from the fear that we are the people we're taking care of, what we have to do is be careful of our language. Be careful that we're not moving too far out of the healing circle, because then we forget that the people that we're taking care of could be our mothers, our fathers, our brothers, our sisters, our children, or us.